Welcome to Conversations with a Black Doctor. My name is Jeff Hutchinson, Dr. Jeff Hutchinson. I am part of the Austin Black Physician Association. And tonight we have a conversation about maternal health. Austin Black Physician Association is dedicated to improving the health of the Black community. And we're also dedicated to inspiring future physicians to take care of the Black community. With me today, I have two fantastic physicians, both OBGYN. First is Dr. Melanie Belt, and second is Dr. Crystal Berry Roberts. Welcome.
Thank you. Thank you.
All right, this is a conversation. So we're going to get started, and we've been starting now with stories that have been either in the news or just stories that people have heard about that deals with this topic. And we know that Black maternal health is unfortunately such a health disparity in this country. We all heard about the story of Serena Williams when she had her baby, and the near tragedy that happened with her. What did you think, Dr. Berry Roberts, when you heard about what happened to Serena Williams?
Right. I think for me, it was not surprised, and I think a reminder, and a harsh reminder, that we sometimes think that we can educate ourselves out of the risk group or attain enough, fame and money, to be frank, to where we think now the playing field becomes equal for us in regards to healthcare. And I think Serena Williams' story, I would never say a near tragic experience needed to happen, but if it is going to happen, that it can bring attention to her reality and how it mirrors those that don't have as much money as she has or as much fame. And people get to say that, hey, if it could happen to her, it could happen to anybody. And I think that was my first set of thoughts when I heard her story.
Yes, it was surprising to all of us who knew that she's an athlete, and we expected an athlete not to have the same risk of dying during delivery. Dr. Bell, what did you think, or what did you talk to people about when you heard her story?
Well, of course, I was shocked, but I guess not really, as Dr. Berry Roberts said, because we know that unfortunately, African American women have a higher risk of mortality in labor, and it doesn't matter how wealthy you are or how famous you are, you're still at risk. And we all know these stories. I have friends that are very educated that have experienced difficulties in labor and have also almost died. So, unfortunately, it's something that we still face. And although it happened to Serena, things haven't changed. Nothing has been done. And, we've talked about it and talked about it, and daily, this is still occurring on labor and delivery units nationwide.
Thank you both. And something I didn't mention earlier, now is really a conversation. So if it's okay, I know a lot of times women's titles, women doctors don't often get the privilege of being called by their title all the time. But because it's between us, if it's okay, I can call you Crystal and Melanie. Please call me Jeff, and we'll continue on. The next topic I wanted to talk about is if you had a niece who was thinking about having a baby, what advice would you tell her about to take care of her health and to be prepared for the eventual time of her getting pregnant? And let's start with you, Melanie. What would you tell someone who is related to you about getting pregnant?
Well, of course, hopefully, I hope that they have no medical problems, but I would start with, taking a prenatal vitamin before they conceive. That's very important. You want to make sure that you have enough folic acid in your system 30 days prior to conception. If they do have medical problems, of course, you want to have those things under control before conceiving. Example would be diabetes and hypertension, things like that. And then, of course, once, if it was my niece gets pregnant, uh, to get early prenatal care. That's so important. And in our community, we don't always see that. for various reasons, whether that's lack of insurance, or maybe they're in a situation where they're not married and they're ashamed and they're unsure, or what have you. So early prenatal care is important for dating and things of that nature. They also we offer all kinds of genetic testing, things like that. So I would encourage my niece to definitely get the genetic testing that we offer. I would encourage her to make all her visits. Um, and then as she gets further along, if anything happens, if she's feeling any kind of way, I would make sure that she is persistent with her physician in expressing her symptoms. I have a headache, or I have blurred vision, or this is going on with me, and just make sure that they address all her symptoms and she's not just blown off. And if she is, be persistent, go back again. I'm not feeling good. This is going on. Because oftentimes, and with Serena Williams, when she said she was short of breath, they kind of blew her off initially. And it was because she was persistent, and it was because she'd had a pulmonary embolus before that they recognized it. So I would make sure that with my niece, I would say, no matter what, be persistent, keep telling them again and again, so that your complaints do not go unrecognized, because that's what happens to us. People do not take African Americans seriously when we're in the hospital, or when we're in doctor's offices. They just kind of, rush us in and out for whatever reason, and don't always hear all of our complaints. So that's another thing that I would make sure that she is doing. And I make her aware of the diseases that are very common in pregnancy. Pre-eclampsia, the symptoms of that. And when she gets further along and delivers, postpartum hemorrhage is another thing that happens to women on labor and delivery. So we'd also discuss that when it gets closer time for her to deliver.
Perfect. I'm so glad that you mentioned about being persistent. That's actually not the first time that we've talked about this in this forum. There's so many other conditions and diseases that we encourage all of our patients to advocate for themselves, to be persistent. Crystal, what would you say to a niece who is thinking about getting pregnant?
And definitely mirroring everything that Melanie has said here. And some other things that could be helpful as well is, I think we oftentimes are okay with taking the person that's presented to us as, this is going to be my doctor, and recognizing you have choices. You don't have to just take the person assigned, especially like how our office works. A patient gets assigned on kind of a rotational basis, unless they come in requesting a particular provider. So I would tell, my niece, cousin, friend, do your research. You're trying to get pregnant, or you didn't know when it just happened. And maybe that first visit is with a particular doctor. Maybe you'll feel comfortable and you want to continue, but there's nothing wrong with doing your own research beforehand and going in and, again, advocating for the physician that you would like to see. Because what the data and studies have shown us is even if we can't put words to it all the time, there tends to be an innate understanding sometimes and connection between physicians, oftentimes that look like us. Sometimes they don't have to look like us, but some shared life experiences can give that person kind of an instant connection with the patient, and not necessarily they have to be African American. But I think looking for that connection in the provider can help build the type of rapport where you are comfortable being more persistent in your care. Or maybe you don't have to be persistent because they'll hear you the first time. So I think that's something to add in those beginning stages of establishing care.
That's excellent. There are a lot of studies that show just the benefit of connecting with your provider. And sometimes our patients don't know they can ask for someone different or speak up and say that I'm not getting along with this particular provider. We sometimes feel trapped. So I appreciate that. What about near delivery? It's a stressful time. It's an emotional time. It's a frightening time, especially if anything has happened before. What would you tell a woman who is near the time of her delivery, things that she should know, things she should say, or things that she should do? And let's start with you, Crystal.
Okay. I think Melanie definitely got to a lot of the things, the signs and symptoms of the ominous diagnoses that can change the trajectory of a pregnancy literally overnight. So educating her more about the signs and symptoms of preeclampsia, gestational diabetes, signs and symptoms that it may be worsening, what changes in her baby's movements could, prompt more evaluation toward the end, and really reiterating the importance of that continuity of care, especially at the end. There's a reason why we see patients weekly, because a lot can change overnight in between 1 week visit to the next, and not discounting that. And I think for patients who are not of the personality to be a true advocate for themselves, trying to recognize that or help them recognize that in that moment when you're getting closer, labor and delivery, in that moment you're pushing or in the room and deciding what the next decision needs to be, that patient may need, a doula or someone there to help them better advocate for themselves. And I think that is gaining more momentum in our community, but finances can be limiting sometimes, and trying to find options for every woman, whether she's insured or not, underinsured or not, is one of the things I think we need to actively address and bring up in conversation for patients that we think that could be a good fit for.
Fantastic. And Melanie, our family listens to us. Sometimes we're the only person who they trust when it comes to their health care. So is there anything else that you would add to someone who is about to deliver, say that her health is good, but things you still want her to know?
I would make sure, as I said earlier, that they know the signs and symptoms of preeclampsia. That's huge. I can't tell you how many women in our practice, myself and Crystal's practice, we take care of the same patients, come in and develop severe preeclampsia before our eyes. So I think it's important for, if it was a family member of mine, to know the symptoms, the headache, the blurry vision, right upper quadrant pain, or just not feeling right. You need to go in and be evaluated, to know that it's when the blood pressure goes up, things like that. They just have to be educated. I would discuss a postpartum hemorrhage so they can know what that is, what that means, if that happens in the delivery room. And so they won't be shocked if something starts happening, because once you have the baby and you start to hemorrhage, unfortunately, there's not a lot of time for a lot of discussion, with the physician. We try our best to tell you what's going on, but oftentimes you're just, the patient sometimes doesn't hear it all, because they're kind of out of it, because they're hemorrhaging at the time, or they're scared and they don't comprehend it all. So those are things that I would make sure and discuss with my family member. Hopefully they won't experience any of that, but you just want them to be knowledgeable when they're on the labor and delivery unit. And as Crystal said, the doula, that is something that we're seeing more and more African American patients come to the unit, and they have doulas. There are more African American doulas out there now, and they do a fabulous job. And I think that's something that we really should encourage our patients to look into. Someone that's by their side and kind of helps them during these times when they're on the unit. And there are doulas that do it for free, as Crystal said, for the patients that are underinsured. So there are different resources out there for those patients.
Fantastic. We are in the time of a pandemic of COVID, and that sometimes comes up. Hospitals are doing a great job of screening and thinking about that, and trying to protect everyone from COVID. Is there anything special from either of you that moms or future moms need to know about COVID or the vaccine, or anything you want to mention about COVID and maternal health? Let's start. Melanie, you're off mute. You want to start?
Not anything right offhand. I will say that we have had several COVID patients on our unit. And the good thing is the mom may be COVID positive, but the babies have been born COVID negative. So I know a lot of patients have asked about that, and that's a positive. That's good. We're glad to see that. And they're not separating moms and babies. I know in the beginning, there was talk of this, and I think maybe in some states they were doing that, but in Austin, that did not occur. So they keep the mom and baby in the same room. Just the mom has to wear a mask. Um, but as far as COVID is concerned, we're not seeing, I can't think. Crystal, can you think of anything right offhand?
I think now there is this with the COVID vaccine by far, and I know Melanie's getting more questions, and it's a hard thing to counsel about. And I know what I should say as the OB and what our American College of OB-GYNs has said for us to say that, yes, I want pregnant patients, breastfeeding patients to consider getting this vaccine. I'd rather you get this vaccine than get COVID and end up intubated in the ICU. We have enough data to know that the outcomes in pregnancy are riskier and more concerning. But at the same time, I have to empathize with the patient trying to make a decision about taking the vaccine and how she's going to feel after she takes it, or I'm pregnant and do I know enough? So I know the full gamut. And I would tell anyone who's listening to this conversation today to know that most of us want to counsel for it. And we do that, but there should be a level of respect that we give. And when patients are reluctant, and continue to counsel, continue to present it, and support that mom to be or that current pregnant patient with whatever she ultimately decides to do, and just continue stressing mask wearing, hand washing, limiting her contact with people who are not practicing those things.
Crystal, what you said was very powerful and something that we'd like to emphasize, that one, we want what's best for the patient, and we try to have as much patient-driven care as we can. And as providers, we have to admit when we don't have all the information, but we give patients the best information that we have. And one of the best things that we do is listen, because if the patient is fearful about the vaccine and we're not hearing that, there's no way we can have a good conversation. So thank you both for being there and for helping moms and future moms in that area. As we start to wrap up, are there any resources or places where moms, especially Black moms, might go to get more information? Let's start with you, Crystal. Is there any place that you recommend for Black women to go to get better information?
Sure. I definitely, and Melanie and I both have been involved in some capacity with Black Mamas ATX. I want to say the website is blackmamasatx.com. There's the Black Mamas Collective through UT. And doula wise, there's Healing Hands. Gals is one of the volunteer doula groups in Austin that actually partner with the hospital where we are, and we literally can call someone up and get someone there the same day. They take shifts. And I just think it's time for us, and I think I say this practicing in Austin, so it's not the same if I were practicing in, I say, a less savvy city, but I practice in a city where a lot of my patients are savvy. But I think still not knowing that there are resources out there, and doing a little bit of that research or coming to your provider and saying, please guide me. And I think my goal is to try and do a better job of knowing what is out there, so that I know options to provide the patients with.
Fantastic. Melanie, your thoughts about where patients can go?
I agree with the organizations that Crystal suggested. And also I want to add the Black Mamas Matter Alliance is a great website that you can go to. It's very thorough and it has some additional resources there. And also anymothercounts.org is another organization that focuses on maternal mortality worldwide, but also has a section for within the United States, and how you can get some help. So I'd like to add those to the ones that she mentioned.
Perfect. You both have been fantastic. Thank you, Dr. Barry Roberts. Thank you, Dr. Belt, for your time, for your insight for moms, and for your expertise. Thank you to the audience for listening. wherever you are. ABPA is committed to continuing our mission of improving the health of the Black community and inspiring young people and our next generation of physicians, of Black doctors. Please visit our website, austinbpa.com. If you or your organization would like to partner with us, again, that's austinbpa.com. We'd love to hear from you. Thanks again.